My journey with public health surveillance began with profound confusion. Today, I want to share not just my problems, but more importantly, how I transformed that confusion into genuine understanding. This is a story about moving from what is this to how does this protect us. The core confusion was deceptively simple. What exactly is surveillance? Seems straightforward until you realize textbook give you definition, but in reality give you system. First, textbook defines surveillance as systemic collection data which is technically accurate but practically hollow. Second, the real world presents a far more complex system. Third, I was missing the connection between academic definition and real world application. The confusion deep into labyrinth of distinction I didn't truly understand. Passive versus active surveillance, what is the real difference? Real-time versus retrospective surveillance, how do they serve different purposes? This just academic classification. They represent fundamentally different approaches. This is where philosophy illuminates that confusion. Surveillance exists at intersection of data of meaning. Raw number without context, that's statistical noise. Context without grounding in data, that's speculation. It really confusion on how we transform numbers into knowledge that save lives. There's an unresolved ethical paradox in surveillance that even experienced epidemiologists grapple with. Surveillance systems must collect personal health data to achieve their protective purposes. Understanding surveillance means understanding this isn't a flaw to eliminate, it's a fundamental tension to manage responsibility. I could have resolved my confusion by reading more textbooks. The turning point came when I made conscious choice. Stop trying to understand surveillance from definition and start understanding it from practical application. I needed to step out and step into real data from real crisis. My first solution was immersing myself in real outbreak cases study, COVID-19 surveillance response. I saw how passive surveillance identify cases, how active surveillance target high-risk population, how lab confirmation provide confidence, how data gaps create blind spot. Suddenly surveillance wasn't abstract, it was alive responding to a real threat. My second solution was reverse engineering. I start with a complex surveillance data and work backward to identify every component. This revealed that surveillance power comes from integration. Passive system catch what active system might miss and vice versa. No single system is complete. The system's strength lies in combination. My third solution, comparing diverse surveillance systems. Why? Because each disease has unique epidemiological characteristics, transmission patterns, and control strategy. Understanding these differences reveals a critical insight. Flexibility isn't a weakness in our surveillance, it's the system's greatest strength. Here where I added creative innovation to my learning. Rather than seeing surveillance data as isolated statistic, I start view each data point as a part of narrative. A case report isn't just a number, it's a story of transmission, a clue about outbreak dynamics, a signal of something changing in the population. The first major breakthrough came when I shift my fundamental question. Instead of asking what is surveillance, I asked what purpose does its surveillance component serve. Suddenly, surveillance system makes sense not as abstract category, but as a tool designed for specific purposes. The second breakthrough involved recognizing a crucial distinction. Data is not information. Information is not knowledge. Data become information when you add context. Information become knowledge when you add interpretation. And knowledge become action in public health emergency response. With both breakthrough integrated, I reached philosophical clarity. Surveillance complexity isn't a problem to be simplified. It's the nature of the real system. Understanding surveillance means embracing its inherent complexity rather than seeking impossible simplification. I arrived at a new definition that captures what I learned. Surveillance is a multidimensional evidence system that transforms diverse data streams into actionable public health intelligence, not just collection, not just analysis, but the transformation of data into intelligence that enable protective action. I can now evaluate surveillance system critically, not based on how they fit textbook definition, but based on whether they effectively detect threats and enable response. I appreciate the limitation of real-world surveillance without dismissing it as inadequate. Most importantly, I recognize and celebrate innovation in detection methods. Real knowledge required multiple perspectives, genuine understanding, acknowledge uncertainty rather than eliminating it. In science, uncertainty isn't weakness, it's honesty about the limitation of our knowledge and the need for continuous refinement. Understanding surveillance complexity enables smarter intervention. Proper data interpretation makes ethical decision making possible. An integrated surveillance system means stronger protection for the population we serve. This is why understanding matters. Understanding is the foundation of effective public health. My journey transformed a fundamental question from asking what is surveillance into how does surveillance protect population. That transformation is what surveillance is to clarify about what surveillance does represent genuine understanding emerging from active engagement with complexity. My understanding of surveillance continues to evolve, but this journey reveals something important. Understanding